Hello, this is Andre with Tongue Tales on Monday, and today's tale is about the tongue of a 31 years old male with the following complaints: dizziness when lying down, floaters in the eyes, and decreased night vision. He also has nausea and discomfort in the throat, chronic neck pain, and occasional headaches related to neck tension. He feels overall warm, and he also experiences sinus pressure between the eyebrows. Now, let's see what his tongue would tell us. This tongue has a very thin coating. When you see a sign like this, think of it like the stomach is not producing enough of its natural lining, or what we call stomach yin. In other words, stomach lining is a bit parched, suggesting might be some dryness or heat interfering with stomach activity. However, we can also observe that the tongue body is moist, which means the body has adequate fluids to go around and build up the yin qi. Next, we can observe curled up edges on both sides of the tongue. The edges are associated with the liver and gallbladder. When liver qi gets stuck, possibly due to stress, it can heat up and cause liver wind or yang rising. Now, a typical sign of liver wind is a deviated tongue, a neurological sign. We don't see it here, but we can definitely see liver qi stagnation, possibly with heat and liver yang rising. Heat expands, and when we see these curled up edges of the tongue, we can tell there is a lot of constrained yang qi. We can also observe that the tip of the tongue is pointy and swollen. There is lots of yang qi that is thrusting forward and out, so the tip swells up and also extends out. This heat, the yang qi, would typically disturb Shen spirit. We should ask this patient about panic attacks, anxiety, and insomnia. The color of the tongue's body is pink. That's what we like to see. It's a normal color. However, we can also observe that the tip of the tongue is red. A red tip means there is some heat in the upper part of the body, possibly the lungs or the heart. We can also observe this red color spreading along the edges of the tongue. The red edge of the tongue confirms our guess that the liver is overheating, which often happens from qi stagnation. Heat rises and the person may experience headaches, dizziness, as well as symptoms affecting the neck, throat, and the eyes. Next, let us look at these elevated red points on the anterior 1/3 of the tongue. This sign represents extreme heat or even fire toxins in the upper burner, which means inflammation or even some infection in the upper part of the body. Next, please take a look at this irregular vertical crack in the proximal 1/3 of the tongue. A crack here suggests yin deficiency in the heart, possibly connected to emotional or psychological issues. There is also a deep irregular crack at the tip of the tongue. Deep cracks, especially at the tip, often related to emotional stress or underlying conditions. Heat consumes yin fluids and the tongue cracks. Now, a 45-degree crack in the lung area, the right side, tells a different story. Cracks like this often are associated with the chronic lung issues, typically lung yin deficiency or lung dryness. These can manifest as respiratory issues, but can be also associated with dermatological conditions as well as chronic allergies. Now, let's put it all together. We can see a lot of signs related to the liver imbalance, like curled up and red edges of the tongue. And these signs represent liver heat or liver yang rising and correlate with symptoms such as dizziness and warm feelings. Now, the liver opens into the eyes, and floaters as well as decreased eye vision are signs of liver imbalance. However, night blindness is typically a sign of deficiency of liver yin and blood, not heat. But this is perfectly okay, because we often observe that exuberant heat like this, in this case, consumes yin and blood, thus causing deficiency and the signs of night blindness. Now, nausea and discomfort in the throat are also classical signs of liver qi stagnation. When the unchecked liver qi travels up, it gets stuck in the throat and the neck area, causing what is called in Chinese medicine plum pit qi, as if plum pit is stuck in the throat. Now, neck tension and headaches are also part of this scenario. An appropriate classical formula to consider would be Tian Ma, Go Tang Yin, Gastrodia and Ancaria drink. This formula traditionally used for liver yang rising. We can also see the signs of heart fire, like a long vertical crack that starts at the root of the tongue and travels down, as well as this deep crack at the tip of the tongue. We should ask this patient about their sleep, anxiety, and stress levels. And for presentation of this type with heat, fire, and possibly yin deficiency, the ruling formula would be Tiang Wan, Bu Xing Dan, the Heavenly Emperor's decoction, drink, to nourish the heart. It is a very nice and calming formula. It helps with insomnia in many cases, but it also has herbs such as Tian Mendong and Mai Mendong, Apia pagonis, that would also address chronic lung yin deficiency and dryness, and so it would also take care of the lung issues as well. Finally, we should speak about the red tip of the tongue as well as the elevated points at the tip of the tongue. We can connect these signs with the symptoms of sinus pressure between the eyebrows as well as headaches. To me, this symptom seems like a latent sinus infection. In Chinese medicine, we call this fire toxin, and the suitable formula for this presentation would be Chai Ge Jie Ji Tang, Buplurum and Kudzu decoction to unbind the muscles. This formula is effective in treating sinus infections that manifest as fire toxin, as well as it could help with headaches and tight shoulders. And this concludes our presentation of this case. Now, if you have any health issues and would like to know what your tongue tells on you, please send us the image of your tongue and we'll speak about it next. I'm Andre with Tongue Tales on Monday, and I will see you next Monday.